KPBS Evening Edition is made possible by Joan and Erwin Jacobs and by
Hello, good evening. Thanks for joining us. I'm Dwayne Brown. A tentative win for San Diego Mayor Bob Filner in his fight with the Tourism Marketing District. Today, a judge said he won't force Filner to sign an agreement worked out before he took office, at least for now. The deal would let hotels charge an extra 2% for rooms, generating about $30 million a year to market San Diego as a tourist destination. Filner says it's a bad deal for the city. What he wants is for the district to set aside money for the centennial celebration in Balboa Park, limit the pay of its top executives, and encourage member hotels to pay a living wage. Today's ruling is tentative. Oral arguments will be heard tomorrow. There's a challenge in the works against the mayor's order to close the La Jolla Children's Pool at nighttime. The order came in response to this video of two people apparently harassing the seals. The beach is now closed between sunset and sunrise. Advocates for beach access are asking for an injunction against the closure. A victory today for opponents of two gas-powered peaker plants proposed for San Diego. SDG&E won't be allowed to buy power from them just yet, but as KPBS business and environment reporter Eric Anderson tells us, the projects could still be plugged in.
All those in favor, please say aye.
Aye.
Aye. So it's unanimous. It's 5-0. We now turn.
The California Public Utilities Commission voted 5-0 against the power purchase request. SDG&E is asking to buy power from two yet-to-be-built facilities and one refurbished natural gas-fueled peaker plant. The Quail Brush project near Mission Trails Regional Park has become a rallying cry for people supporting alternative power.
I am going to tell you not to build PO-PICO. I'm going to tell you not to build the Quail Brush plant. I'm also going to tell you that you never should start San Onofre again. That's true. But again, those reasons are not why I'm here today. I'm here today to tell you that fossil fuel power plants are now the alternative.
Hugh Warren says the real power generators the panel should be discussing are solar, wind, and geothermal. While the opposition dominated the public comment period, there were supporters. Former state lawmaker Denise Moreno-Duchesne argued for the PO-PICO plant in Otay Mesa.
Depending on power coming from Texas, Arizona, Utah, a lot of that is problematic, and having a couple of peaker plants to support the solar could be useful.
The commissioners left open the possibility that the projects could come back in front of regulators in a couple of years. Commissioner Mike Florio says there is a need for locally generated power.
San Diego has a tremendous record with supporting solar energy and adopting solar energy, and we strongly support that. But every day, whether we like it or not, the sun sets, and the production of photovoltaic electricity drops off.
Florio challenged the San Diego region to come up with alternatives before the aging Encina power plant needs to be replaced. Eric Anderson, KPBS News.
An environmental group says restarting the San Onofre nuclear plant would cost more than buying replacement power from other sources. Friends of the Earth says running one reactor at partial power would cost $214 million, while power on the open market would cost $66 million. The group says the numbers come from information Southern California Edison provided the PUC. Edison says the analysis is misleading without rational understanding of the costs involved. Could Sprinter trains be running again by June? County Supervisor Bill Horn is hinting it might. North County Transit directors got an update today on repairs to the commuter line. Brake problems halted it earlier this month, and the parts come from Germany. Engineers say they'll be testing two types of brakes. A new poll out tonight finds falling support for high-speed rail in California. The problem, apparently, the $68 billion price tag. Public Policy Institute of California found 54% of those polled were against the escalating cost of the project, but if the cost went down, support went up.
Congratulations, Senator.
Ben Hueso sworn into the California Senate today, a little more than a week after winning a special election. He'll represent parts of southern and eastern San Diego County, and with his swearing in, Democrats have regained their supermajority in the state Senate. A new study estimates 250,000 guns are smuggled from the U.S. into Mexico every year. Peggy Pico explains how the surge is linked to drug traffickers and the impact on local gun retailers.
The University of San Diego's Transborder Institute's new report found cross-border arms trafficking is worse than previously thought. Joining me with details is the lead researcher on the study, assistant professor at the Joan Kroc School of Peace Studies, Topher McDougall. Professor McDougall, thank you so much for talking with us today. What were some of the key findings of this report?
We found that about 2.2% of U.S. domestic demand is attributable to demand arising south of the border, so Mexico and Central America. And that translates into roughly 250,000 firearms per year purchased with that intention, and probably around $127 million.
How much of those trafficked 250,000 are actually seized by authorities either on this side or the other side of the border?
Roughly, at last count, which was around 2009, it was about 37,000. So about 5,000 of those were seized by U.S. authorities, representing about 2% of the total.
So just 2% of the guns, of the illegal trafficking of the guns are being
seized by U.S. authorities, and then another 12.5% or so are being seized by Mexican authorities.
So altogether about 14% of the
14
trafficking
or
were caught. Your research, you touched on this, found that some of the U.S. gun shops here, especially along the border, can maybe or are profiting from this smuggling. Tell me about that.
Yes, well, because we were just estimating demand in total, we can't say where these where the purchases are actually being made. We don't have that data. But what we can say is that 2.2% demand represents probably about 45 to 47% of U.S. gun stores who are in some way economically dependent upon that.
For the demand, selling it to whomever they're selling it for. And these are legitimate gun stores, legitimate retailers here in the United States.
Absolutely. They have a federal firearms license to retail issued by the ATF.
No, Mexico has just one legal gun shop, but that's my understanding, and for the whole country. Do you think that this increased demand for weapons could have some legitimate, basically, reasons, not just for the drug cartels? Could it be for, they don't have access, there's only one shop, they have to go maybe the non-regular route?
Yeah, absolutely. I think that there's probably a large pent-up demand in Mexico simply for private security reasons. I've gotten, just in the past few days, some emails from people living in Mexico saying that they have bought illegal firearms there, that they contribute to this demand themselves, simply because, as we've seen, after a decades-long sort of decline in the homicide rate in Mexico since 2006, this has spiked, and roughly 120,000 people have died as a result of drug violence there in the past five to 6 years.
So people might be buying these to protect themselves, to protect their families or themselves from the crime that's going on there. I can't imagine that this was easy data to get after all these are illegal operations going on. How did you get your data for this report?
Yeah, so we don't have data on actual purchases. That data, disaggregated data on purchases, it's prohibited for the ATF to collect that. So, in fact, what we did was look at county-level stats provided by the ATF on gun stores, on these FFLs, Federal Firearms Licenses, and we tried to predict the number of FFLs in each county as a function of distance from the border, where this distance is effectively a price that you are incurring through fuel costs and time spent getting there.
So looking at sort of the geography of it, certainly there's some limitations on the data that you got, I'm sure, because of this. Your report laid out some possible solutions to this sort of rising trend. Can you tell us a little bit about those?
Sure. Well, one really obvious one is to start a more robust kind of background check where you would be looking for profiles of straw purchasers. Because right now, even if the legislation that is currently being considered at the federal level is passed and straw purchases are made illegal, we have no way of telling who is a straw purchaser and who isn't. By definition, straw purchasers do not have the types of backgrounds that would raise alarm bells.
Tell us when you're saying straw purchases for people who don't know what that is.
Sure. This is somebody who's hired by somebody else who has a clean record to go into a store and make a purchase on behalf of this other person and pass the guns along to them. And then these guns will be trafficked south of the border.
And is there a way to track them, you think?
I think that there's probably a way of finding a probabilistic model that would say how likely is it that you are a straw purchaser. I think other ways that we could get at this problem would just be to collect and disseminate disaggregated data on purchases, which we do not have right now, and as I said, the ATF is prohibited from collecting it.
All right, we are out of time. I want to let folks know they can see the entire gun trafficking report on our website, kpbs.org. Professor Topher McDougall, thanks so much for talking with us.
Thank you for having me.
This month, for the first time in more than 30 years, San Diego Hospice will no longer care for dying patients. A series of troubles, including a Medicare audit and bankruptcy, are closing the hospice down. Tonight, an in-depth look at aging and dying in San Diego. Our coverage begins with Joanne Farian from our KPBS and iNewsSource investigations desk. She introduces us to a husband and wife profoundly impacted by the troubles at San Diego Hospice.
Last November, Adam Saling received an unexpected letter. It was about his wife, Krystyna. Krystyna has late-stage Alzheimer's disease. She can't walk or talk. It's difficult for her to eat or even sip juice without assistance. The letter was from San Diego Hospice. It was notification that after receiving hospice care for the past 6 years, Krystyna was being discharged because she was no longer dying.
That was very interesting. It would have been funny if it were not so dramatic.
Just 9 days prior to receiving that letter, Krystyna lost her ability to walk. The disease was forging ahead. The irony of the letter was not lost on Adam. He had witnessed his wife's slow decline from strong and vital woman to a whisper of her past self.
The letter from hospice said essentially that she is no longer terminal. I couldn't understand that because once a person is terminal, it's terminal until the end.
After 6 years of receiving weekly visits from a team of nurses and health aides, Krystyna was cut off from the government-paid service as San Diego Hospice, one of the oldest and most respected hospices in the country, scrambled to discharge patients who may not have been eligible for care. She was not the only patient discharged. There were more in her nursing home, hundreds more across the county. In total, San Diego Hospice reduced its patient population from 1,000 to just 400 late last year as it tried to get ahead of a Medicare audit and federal investigation questioning whether the people they were caring for were actually dying. Whether it was a matter of compliance, finances, or some combination of the two that led to the demise of San Diego Hospice is still unclear. But the experience has left Adam Saling questioning the rationale of the system and the integrity of the trusted institution that provided his wife treatment when she didn't need it and abandoned her when she needed it most. Because what is clear to Adam, each day that passes brings him closer to saying goodbye to Krystyna. Adam and Krystyna first met at a junior college in Germany. Both had been born in Poland, both landed in Germany as refugees with their families. Adam, shy and 3 years junior to Krystyna, didn't know whether he stood a chance with a young woman who already seemed so poised and ready to take on the world. School ended, and so did their brief romance, but they would meet again, this time in Chicago as young immigrants. Adam finally proposed, and the two were married. That was in December 1956. The next several decades brought with it a move to San Diego, new careers, and a daughter, Magda.
Life was very nice in Southern California.
Until 2003, Krystyna was diagnosed with Alzheimer's disease.
There was absolutely no indication that Krystyna was threatened by a disease, especially a mental disease. She was, her mind was very active, and she was a rather brilliant person.
Krystyna Saling remained in hospice until she was discharged almost exactly 6 years after being accepted. Whether she was ever eligible for care when she was first referred back in November 2006, and whether San Diego Hospice ever properly recertified her to remain in care is at the heart of why the hospice is being investigated by the federal government.
Even then, she was not in a bad condition.
Hospice is under scrutiny nationwide. The federal government wants to know what's behind its soaring cost, $13 billion in 2010, 4 times what it was a decade ago. Add up the monthly benefit San Diego Hospice was paid for Krystyna's care over the 6 years, it totals more than $300,000. That's for one person. Dr. Doris Howell founded San Diego Hospice back in the 70s. She's the director emerita of the hospice's board. She says she knew taking on too many Alzheimer's patients for too long was causing a problem with Medicare.
I'm sure we admitted some Alzheimer's patients because they had other diseases that deserved treatment that we could treat and make their life more comfortable. But it's hard to throw them out.
She says Medicare warned them about the problem before.
We sort of looked at them and said, well, do you want us to, at 12 o'clock on 6 months, you want us to say to the patient, you're no longer eligible?
Former employees who spoke to the KPBS and iNewsSource investigations desk say the hospice accepted almost all patients who came to them for help over the years, at times stretching eligibility requirements. They didn't want to be named for fear of prosecution for Medicare fraud, but they say there was an unwritten policy to find a way to say yes. One doctor told us, the intentions were really good. We saw all the suffering and pain, people who couldn't get into community resources. It could have been overreach. Adam spends 4 afternoons every week with his wife in the nursing home. He speaks softly to her in Polish. She is losing the ability to swallow, the final stage of Alzheimer's. Her doctor once again recommended hospice care. Weeks after being discharged from San Diego Hospice, Krystyna was accepted into care by another hospice provider.
She may die within weeks, or she may live more than 6 months. There is no way to tell.
Adam is writing Krystyna's biography and compiling her many essays and poems into a book. He wants people to know who his wife was: survivor of war, activist in the Polish-American community, student of history, someone who liked to take long walks around Miramar Lake but was just as comfortable traveling to Turkey on a lone mission to learn more about her father, mother and grandmother committed to raising strong women.
If nothing else, I would like our friends in the community to remember her.
The Saling story is one that's familiar to a growing number of San Diegans coping with family members who have Alzheimer's and other age-related conditions. Joining me with more on the situation here and where to get help are my guest, gerontology specialist and professor at SDSU School of Social Work, Mario Garrett, and Mary Ball, CEO of the Alzheimer's Association of San Diego and Imperial Counties. Thank you both for being here.
Pleasure.
Thank you. Mario, paint us a picture of the aging population here in San Diego.
Well, everyone knows about the baby boomers. What people do not know, though, that we have about 500,000 older adults right now in San Diego, but that will quadruple, multiply 4 by 2030. So we'll have about 2 million 60 and over population. But what is unique about San Diego is we have different cities with different patterns of aging. So, for example, you go to La Jolla, Del Mar, Coronado, where we get more than a third of the population are older adults. So we get patches in San Diego of aging. But also what is unique in San Diego is the Latino population, 37% Latino.
Let's come back to that, because I want to talk specifically about those neighborhoods and those groups. But Mary, I did want to talk to you about this growing population here. I know research says that there's about 5 million Americans that have Alzheimer's, and that it's the 6th leading cause of death here in the country, and the 3rd leading cause of death, you said, here in San Diego. What services specific to Alzheimer's is available here in town?
Well, the Alzheimer's Association here is to support families and the person with Alzheimer's disease right when they get diagnosed. So one of the first things we do is we offer a helpline. It's 1-800-272-3900. People can call it 24 hours a day, 7 days a week, and talk to trained clinicians in Alzheimer's disease and get answers to any of their questions.
So would these people be able to help them find services? Let's say they didn't have Medicare, or let's say they didn't really have Alzheimer's, they had some other sort of dementia?
Absolutely. And then we have staff that will follow up with people through their journey and ask them, what are the services that they need? How are things going? How can we help you? So the association is here to help them through what is most likely a 10-year journey with Alzheimer's disease.
And Maria, talking about this long-term journey, let's go back to these patches and these groups you were talking, especially among, not geographically, but among ethnic groups. Your studies have found that Latinos are at risk of really growing.
Incredible, and not just the Latinos. We specifically looked at Latinos because they're such a large minority in San Diego County and Imperial County, but also Asians are in the mix here. With Professor Ray Valle, just published a paper today, The Population of Aging, and what we found.
Well, go ahead.
What we found is that even though the Latino population will increase 6 times by 2050, the Alzheimer's rate will go 11 times higher.
So 6 times in population growth, but 11 times, so disproportionately.
And that is because there's some preconditions that Latinos suffer more than the other populations: diabetes, high blood pressure, cardiovascular disease. And what we need to do is, what we're talking about is, by 2050, 95,000 caregivers being impacted. 95,000, that's just in San Diego County. So we need to be a little bit more proactive, which we are not very good at, even though in San Diego we have a lot of very good services.
And let's talk about that. Mary, how are you preparing here as far as what I'm specifically thinking about? There's a lot of people that are in the, like the story we saw in this sort of gap area, right? That maybe their insurance doesn't cover it, maybe they're not ready for a hospice, maybe they have Alzheimer's. How is your organization and others like you preparing for this change?
Well, we're always trying to build additional capacity because, as Mario said, the numbers are skyrocketing. There's 60,000 people today in San Diego County living with Alzheimer's disease. Estimates are in the next 15 years, that number's going to double. So you're talking 15 years from now, over 100,000 people living with this disease. So we are trying to build more resources. To our helpline, we're getting over 500 calls a month. Our calls to our helpline are up 68%.
Wow.
Over last year.
So it's definitely going.
It's a quiet epidemic out there in San Diego and across the nation that, as a community, we've really got to put resources in and put more programs in place to help people.
And the problem with older adults is it's not just Alzheimer's, it's other issues.
All sorts of health issues that they can't get.
Medical issues, transportation issues, income issues, so housing issues. They're all combined. This is, and what we are doing is we are addressing them purely as a single problem, rather than as a transformational issue.
Unfortunately, we are out of time, so I want to send people to our website, kpbs.org. There are links for these services. They can find out more about your research, so that's kpbs.org. Thank you both for joining us.
Thank you.
Thank you.
I'm Jeffrey Brown. On the next News Hour, a story of economic development in Chattanooga, Tennessee, the city with the fastest internet access in the Western Hemisphere. That's Thursday on the PBS NewsHour.
Well, clouds are still hanging around San Diego. We'll see more of them along the coast through the weekend. The inland valleys might get some partial clearing by Saturday. Partly cloudy in the mountains, too, and in the desert, look for temperatures in the 80s. Did you know there's a place in San Diego County where whatever you say may come back to you? It all has to do with the peculiar geography of the particular spot. as Ken Kramer shows us in tonight's story about San Diego.
I want to take you to a beautiful valley here, a little bit south of Highway 94 in Jamul, where the story is that at certain times when the wind is blowing just so, that wind might carry your voice to the hills beyond and back again so you could hear an echo. Well, let's see.
Hey! Comes from that way.
All the way to that mountain and all the way back? I don't think so.
Hey!
Did you hear it?
Hey!
It seems to bounce off some of the closer-in hills, or maybe ricochet off some nearby rocks. Terry Levlon has a house down the street. His dog barks once in a while. We listened, but no dog echo. If the dog wants an echo, I guess he makes his own. Terry says he's heard coyotes echo in the night. That's pretty strange to experience, but nobody actually comes around and yells.
Hey!
I hadn't seen anybody.
Until today.
Until today.
And I don't think it would be much appreciated if people started showing up doing it all the time. Anyway, I guess the sound bounces around here if you think it does, and you listen for it.
Hey!
How else would this Jamul place have gotten its name, Echo Valley? You know, we had to see if it was a true story about San Diego.
Hey!
You can find all the day's news on our website, kpbs.org/evening edition. Thanks for joining us. Have a great night.